There are lots of different ways to assess student learning, and establishing some common vocabulary provides a framework for identifying the most appropriate ways to use assessment as a part of quality instruction. Two of the most common types are formative assessment and summative assessment. Let's break those down. Think of formative assessment as informing instruction, and summative assessment as a summary of learning. Formative assessments are really a part of formative instruction. The goal of formative assessments is to inform instruction along the way so that teachers can react in real time by modifying instruction, including how the material is being taught and which students are receiving extra help or extra challenge. Formative assessments can take on many variations, from informal checks for understanding, such as asking students to verbally respond to questions during lessons, to more formal contexts, such as quizzes in the middle of a unit or diagnostic tests prior to teaching. For summative assessments, the goal is to determine if the student met the learning targets specified in a particular amount of time, such as a unit test or an end-of-grade test. Summative assessments include content students have learned over many weeks or months, or in some cases, even more than 1 year, such as a high school exit exam. Because summative assessments are given after instruction has occurred rather than during instruction, the results provide information about how the student is doing for accountability and more formal monitoring progress. For example, parents can see whether their student met grade level expectations based on an end-of-grade proficiency test. Sometimes the same test could be summative or formative, depending on how it is used. For example, an educator might give a pre-test at the beginning of a unit as a formative assessment, and then administer a similar version of that test as a summative assessment at the end of the unit. Instruction is most effective when including both formative and summative assessments.